Nurse Billy. I'm going to be taking care of you. Today we're going to do a head-to-toe assessment. Is that okay?
Yeah.
Okay, I need to check your armband. Can you tell me your full name, please?
Chloe May Wooldridge.
Okay, and your date of birth?
October 17, 2001.
Okay, perfect. Now I'm going to ask you a couple questions. Can you tell me where we're at?
The doctor's office.
Good. And what are we doing today?
A head-to-toe assessment.
Good. And who's the President of the United States?
Donald Trump.
Perfect. Okay, so you're alert and oriented ×4. We're going to do some vital signs. I'm going to take your blood pressure on your right arm first. Good. 122/68 for your right arm. And now I'm going to ask you, before we do the left arm, can you rate your pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt?
0.
Okay, perfect. Now I'm going to take your pulse. Okay, now we're going to do your blood pressure on your left arm. To inspect your hands and nails for any lesions. Your color is acceptable with your skin. The texture is good. They're warm, moist. Good. Okay. Now I'm going to inspect your head, and it is acceptable size to your body. Skin color is acceptable. Your eyes and ears are even. Perfect. Okay. Now I need you to close your eyes tightly and then open them. Good. I need you to smile, frown, and puff your cheeks. Good. To palpate your head, and I'm going to feel for lesions or skin breakdown. And now I'm going to look for lice or baldness. Good. Okay. Now I'm going to push here at your temporal arteries, and I need you to bite down for me. Good, and bite down again. Good. Okay, now I need you to resist my hand while I push. I need you to open your mouth. Perfect. Okay, now I'm going to check your jaw, so open and close. Good, and again. Good. Okay, now I'm going to feel your sinuses, and I need you to tell me if there's any pain while I put pressure on them. Any pain here?
No.
And any pain here?
No.
So your eyes are even, your scleras are white. I'm going to pull your lower eyelids down, nice and pink, no redness, you have no swelling, and your pupil size is even. Good. Okay, so now we're going to do the smell and eye chart. So I need you to cover one of your eyes, right or left, and I need you to read the lowest line that you can read.
GLKNOP.
Good. Okay, now I need you to cover the other eye.
GLMOKD.
Good. And now both of your eyes, please.
FDLJKT.
Good. Okay. So now we are going to do this with the pen light. I need you to watch the pen with your eyes, but do not move your head. Good, and there was no shaking with that. Okay, so now we would dim the lights normally, but you're going to stare off in the distance at an object. Good. Okay, now I need you to watch the pen into your nose without moving your head. Now I'm going to look at them first for any drainage, redness, swelling. Do you have any pain in your ears?
No.
Good. Okay, while I touch, I need you to tell me if there's any pain while I'm palpating.
No.
This ear?
No.
Okay, I'm also going to palpate the targus. Any pain there?
No.
And here?
No.
Okay, I'm going to look at your mastoid process. Is there any pain when I palpate there?
No.
Good. No swelling or lesions. Any pain while I'm pushing there?
No.
Good. Okay, so now I would get the otoscope to look at your tympanic membrane, and it would be pearly, gray, and shiny. And to look inside with an otoscope, for an adult, I would pull up and back and look inside. Okay, perfect. So now I'm going to do a test, and I'm going to cover one ear while I whisper 3 words, and then we'll do the same for the other side. Okay, so I'll cover this side.
Dog, cat, horse.
Good, and now this side.
Strawberry, banana, watermelon.
Perfect. Okay, so now on to nose. So I'm looking at your midline, and your nose is in the middle of your face. I need to look at your septum. Looks good. There's no drainage. I'm going to use my pen light and look in your nose. Looks good. No drainage, no blockage. Now I need to do the patency of your nose. So I need you to close one nostril and breathe in and out of the other. Good, and as well with the other. Good, and your airflow is good. So now we're going to do the sense of smell. So I need you to close your eyes, and I'm going to put something in front of your nose, and you're going to tell me what you think it is.
Orange.
Good, and this is orange. We're going to inspect the mouth. So I'm going to look at your lips first. They are nice and pink and not chapped. Good. Now we are going to inspect the inside of your mouth. So I need you to stick your tongue out and move it side to side. Good. And I'm going to look inside of your mouth at your cheeks to make sure there's no lesions. Good. And I'm going to examine your tongue. Make sure it's pink and moist. Perfect. I'm going to ask you to lift your tongue up. Look underneath. Perfect. Okay, now I'm going to look at your soft and hard palate. So open up. Good. There are no cavities. Okay, now I'm going to look at your uvula and make sure that it is midline. And I need you to just say, ah.
Ah.
Perfect, and your uvula moved up. Okay, now we're going to do gag reflex. So open up. Good. And now that's it. So you can swallow without any pain. Perfect, and you're not hoarse. Good job. To do the neck, so I need you to look up so I can look at your trachea, make sure there's no lumps. I'm gonna palpate it. Any tenderness there?
No.
Good. Okay, so now I need you to look side to side. Good. Up and down. And then I need you to bring your shoulders in, and I need you to shrug against my resistance. Good. Okay, now I would put you at a 45-degree angle to look at your jugular vein. And I need you to look this way. Good. And there's no distension on this side and no distension on this side. Perfect. Okay, so now we are going to, I'm going to feel your lymph nodes, and I need you to tell me if there's any tenderness when I'm pushing on your lymph nodes, okay? And I'm going to feel for masses. So pre-auricular, good. Post-auricular, good. Occipital, parotid, jugular digastric, submandibular, submental, superficial cervical, deep cervical chain, posterior cervical, and subclavicular. Good. Any tenderness in any of those? Extremities. So I'm just going to check for any lesions, any redness. Looks good. I'm going to do your radial pulse on both sides, and they're both good, 2+. Now I'm going to look at your hands. Your joints look good. We're going to do capillary refill, so I'm going to push on your nail bed. Good. In less than 2 seconds, that comes back. Good. Let me check this hand. And we are going to do skin turgor, so I'm going to pinch your skin up, and that comes back fast. Nice. Okay, so now we are going to do your brachial pulse. Good, and those are 2+ as well. Now we are going to do some strength tests. So you're going to squeeze my fingers as hard as you can. Good, and you're going to put your arms up, and against my resistance, push as hard as you can. Good. Okay, so now I'm going to hold this elbow, and I'm going to move to listen for any abnormalities. Good, nothing. And perfect. Okay, so now I need you to stand up right here. Maybe face this way so they can see. And you're going to put your arms out in front of you and close your eyes, and I'm just watching to see if any arm comes up higher than the other for 10 seconds. So I'm going to examine your chest for any lesions, wounds, scars. Good. I'm also looking to make sure that you're not having a hard time breathing. And then I am going to look from the side and make sure you don't have a barreled chest, which you do not. Good. Okay, so now I'm going to oscillate your heart sounds, and I'm going to listen in 5 different places. And then the last place, I'm going to listen for a full minute and get your apical pulse. Okay, so now I'm going to find your apical pulse. Okay, and I'm going to listen for a whole minute. So 62 beats per minute, which is normal because normal is 60 to 100. Okay, so now I'm going to use the bell side of my stethoscope and I'm going to listen in those same 5 spots for any heart murmurs. Two lung sounds, and we're going to do your anterior side first. So we will start at the apex of the lung. I need you to breathe in and out. Good. Good. Okay, so now I'm going to listen on your sides. So this side. Good. Good. Okay, now we're going to do the anterior side, so I need you to turn. Yeah, that's good. Okay, so same thing. I need you to breathe in and out when I place this. Okay, so now we're going to do the abdomen. So when was the last time you had a bowel movement?
Yesterday.
Okay. Do you have any problems with urinating? Does it hurt? Is it hard to start a flow for urination?
No.
Okay, and when was your last menstrual period?
3 weeks ago.
Okay. So now I am going to listen to your bowel sounds as there's no lesions, masses on your abdomen. So I'm going to listen for a minute in each spot. I'm going to listen in the right lower quadrant first. Now the right upper quadrant. Left upper quadrant. And left lower quadrant. Good. Okay, now I'm going to listen with the bell side of my stethoscope for any bruits, and I'm going to listen in the aortic artery first. And then the renal arteries, right and left, so right or left first. And left. Good. And then the iliac, left. And right. Okay, good. So now I'm going to do palpations, and I'm going to do light first and then deep. So just let me know if there's any tenderness when I'm pushing. Any tenderness or pain when I do this?
No.
Good. Okay, so now I'm going to do deep, so I'm going to use both hands. now I'm going to palpate your liver. Good, and your spleen. Any tenderness when I'm palpating those? Good. Okay, now I'm going to do percussions. Good. So your leg color to your toes looks good, acceptable, nice and pink. Your hair growth looks good. Do you have any pain in your legs ever?
No.
Good. There's no redness over the joints. Okay, so I'm going to feel your popliteal pulse behind your knees. Good, and they're even bilaterally. I'm going to push on your tibia for edema. Good. Good. Okay, so now I'm going to feel your posterior tibial pulse. And they are both even bilaterally. And now your dorsalis pedis pulse. Good. Okay, now I'm checking for capillary refill just like I did on your fingernails. Looks good. Okay, so now I need you, I'm going to do this. And that is normal for the toes to curl in. Good. Okay, so now I need you to push against my hands with your feet. Good. And push against my hands with your legs. Good. Okay, so now I need you to roll over on your stomach. This will be the last thing. I need to check her back for any lesions, moles. Good. Normally we would do the reflexes, and I would do them in the biceps, the brachial radius, the triceps, the patellar, and the Achilles. Okay, so can you go ahead and roll your ankles so I can check your range of motion? Good, and then stand up and just move your hips so I can check your range of motion in both. Good. Okay, can you bring your finger to your nose? Good. And heel to shin on both. Good. Okay, go ahead and touch your toes for me. Good. And stretch right and left so I can check your spine. Good. Okay, now I need you to walk across the room. Just normal. Good. And walk back to me, heel to toe this time. Good. And then I need you to walk on your toes. Good, and walk on your heels. Good, okay, now we're going to do the Romberg's test. So you're going to stand with your eyes closed, facing me for 30 seconds. Good, okay, one more test. You're going to do the shallow knee bend. So you're just going to bend with your knee. Make sure with both. Good, and other side.